Hi, I'm Dr. Khalil. I work in Alliston since 2011. I do family practice and I do emergency room department as well. I've been working in Canada since 2005, in Manitoba till 2011. Then I moved here to Ontario, and because I love rural family medicine, I would like that's why I relocated to Alliston area, which is amazing. I can do everything I would like to do. I do both family practice and I will do my emerge shifts. Basically my practice is about 3 days in my office and 2 days in ER. Plus that I do also on call for sick babies, well baby as well, and I also on call for backup for emerge. My family practice, I am working with Alliston Family Health Team. In our location, we are 5 physicians. Plus that we have allied family healthcare professionals. We have a nurse practitioner, we have dietitian, we have a clinical pharmacist, 2 counselors and chronic disease management nurse, and some other like respiratory therapist as well. My rostering is around 1,300 patients, plus 100 patients non-roster. I see them within 3 days per week, plus my nurse practitioner sees some of my patients. I love doing mix between my office and emerge. That's why I work here in Stevenson Hospital. I do 2 shifts every week, plus 1 weekends I do emergency. I'm also part of the administration program in the hospital. I'm a board member for the hospital. I am also medical advisory committee member, as well as I am the vice president of medical staff. I also do admin in our clinic. I am the our previous board chair, and I'm one of the board members up till now. In Emerge, it's in the hospital. It's a small hospital, which I enjoy doing variety of stuff. Very friendly atmosphere. As I said, I do Emerge. We do a lot of procedures in Emerge, including intubation, central lines. We do lumbar puncture. We do all kind of reductions, all kind of fractures and joints. Plus, of course, ACLS with resuscitation and CPR, so it's very interesting. In the hospital, we have medical and surgical unit for admission, and we have about 30 beds. And we have coverage 24/7 for obstetric. We also have 24/7 gen surge. We have some outpatient clinic. We have a fracture clinic. We have a full-time radiologist and we have CT 24/7, ultrasound every day up to 6 or 7 o'clock p.m. I usually book my patients for 15 minutes. I see about 30 patients per day, but for my residents, I usually start with 30 minutes booking for them. So they get used to our patients. It's everything new for them, and then if they feel more comfort, we can keep 30 minutes and then we can double book 2 or 3 patients in the morning and in the evening or afternoon. I don't do after hours except 1 day every 8 weeks. So the total patients per day for my residents will be about 15 or 16 patients, and mainly I will be physically present at the clinic when they see my patients. I don't regularly see them because they are very smart doctors, so unless they ask me to come and see one of the patients, like for derm case or something they want to ask, or they want me to say hi to the patient, or one of the patients wants to say hi to me, because they are well trained, they only want to do more stuff. I would love to also do with them some procedures in my office, including I do injection to all joints except the hip joints in the office, but we can do ultrasound guide if they're interested to do that. I do lumps and pumps. I get some referrals from my other colleagues because I do more procedures and I do more plastic stuff for them. I do injection for trigger fingers if they want to do that, and bunch biopsies, all kind. I do growing toenails if they would like to do that with me. First one will be under my supervision, then if they feel comfort to do it by themselves, I'm happy to arrange for them. I think that's most what I do in my clinic, and in Emerge, as I said, we do everything. Like normal Emerge department. Plus that I do some on-calls for Emerge. What that means that I am on call for backup. So if it's super busy, I come and help with my resident. And also if we need to transfer critical patient to a bigger center, if Orange is not available, we'll do like transfer medicine, which is really very interesting and will be great experience for my residents. I'm also on call for, because we don't have pediatrician right now, so they choose the 3 most experienced in family medicine and more comfort for kids to do well baby exam, as well as if sick babies, which is a great experience. We got some extra training from sick kids to do sick baby resuscitation and transfer them to through bridge to ICU sick kids or any other hospital. Our bigger center, it's New Market Hospital, which is about 45 minutes south of us. So in terms of our EMR, we use at the hospital Meditech, which I think almost universal in north of Toronto, and we use in my clinic PS Suite. In terms of Alliston, it's a very nice small town. We serve about 50,000 with a catchment for the area, which is including Tottenham, Everett, and a few other. We get some patients coming from Barrie, from Newmarket, from Bradford, and sometimes from Toronto, because our waiting time in Emerge is second best in all over Ontario. I'm looking forward to work with residents coming from UFT. I do the same with McMaster for the last 3 years. I'm looking forward to see my residents work together, and I would like to make sure that we'll let them have fun, enjoy their rotation with us. Thank you.